5 of the most common newborn concerns that get brought to me as a pediatric nurse practitioner in the office. Number 1, irregular breathing patterns. Now, I am not talking about respiratory distress. I am talking about the rate of newborn breathing. Newborns have a very irregular breathing pattern, which often involves short periods where they stop breathing, somewhere between like 5 to 10 seconds sometimes. So they'll be breathing normal, they'll stop for a few seconds, then they'll breathe really fast to kind of catch up. This type of pattern is typically normal and can persist up to about 6 months. Number 2 is the hiccups. Hiccups are fairly normal in newborns, often caused when the baby overfeeds or where they intake a lot of air with feed, and then everything in the stomach kind of pushes up on that muscle under the lungs called the diaphragm and causes it to spasm. You can try burping your baby more frequently, smaller, more frequent feedings and things like that, but often they don't mean any harm. That leads me to number 3 is spit up. Almost all babies have some form of reflux or vomiting. We're generally not concerned about newborn reflux. It typically gets better on its own somewhere around 4 to 6 months. When we get worried about newborn reflux or vomiting is if it's projectile, recurrent, affecting the growth, or generally just causing the newborn to be miserable and unhappy all the time, maybe even refusing feeds. Number 4, vaginal discharge or breast enlargement. Actually very common for some of mom's hormones to still be running through the baby for the first couple weeks. Sometimes you'll see some vaginal discharge. Sometimes they'll look almost like they're developing a little bit of breast, and sometimes they might even have a little bit of discharge. Generally, these aren't a concern. Usually after a few weeks, mom's hormones will run through and these things will subside and go back to normal. Number 5 is poop changes or poop habits. Some babies are going to poop after every feed, and this can be normal, and some babies are going to poop once every 2 to 3 days, and this can also be a version of normal. You should keep an eye on the consistency of the poop. It should be soft and small. Your child should not seem to be in discomfort. But just know that these are 2 wide ranges of normal. These are just common concerns that get brought to me in the office and how most of these scenarios can be within normal limits. You should still always be talking to your trusted healthcare provider about your concerns and your specific scenarios.